So where can I get more coverage? So even from these simple examples, you can see that original Medicare doesn't cover everything, and that out-of-pocket costs for healthcare items and services could add up and take a bite out of your budget. The good news is that you have options for other coverage that can cover other things like prescription drug, and that can help you turn that budget bite into a nibble. On the notes, we are now talking about the Medicare Part C and D and supplement insurance cover and how they can work for you when you decide what Medicare coverage to choose. So you have two options for more coverage. Option 1, what you can do is to add a Medicare supplement insurance and Part D prescription drug to original Medicare. So how it works is that Medigap will cover the out-of-pocket expenses that Medicare Part A and B doesn't cover, and Part D will cover for your prescription drug. Options 2 is you choose a Medicare Advantage plan Part C, and most Medicare Advantage plans include drug coverage Part D and other additional benefits such as routine dental care and vision services. So before we dive into these options, I want to point out that all three of these components show Medicare supplement insurance, Medicare Advantage plan, and Part D plans are offered by private insurance companies. What this means is that part is there may be a number of plans to choose from, and they might vary in coverage and cost. By contrast, original Medicare is administered by the federal government, and benefits and costs are same for everyone. Medicare Advantage and Part D plans are approved by Medicare and held to standards set by Medicare. These private plan options are provided to give you more choices and the ability to fill in of what doesn't cover by original Medicare. We will circle back to this graph later. For now, let's continue through the alphabet and talk about Medicare Advantage, otherwise known as Part C. So it is an alternative to original Medicare. It is contracted directly with Medicare. So it is a private insurance. So plan members are still in Medicare program, which means you still pay for your Part B premium. And the plans are offered by private insurance company and is specific by the county, state, county, and city. So most plans are offered to build in prescription drug coverage. And plans may also include additional benefits such as dental, vision, and fitness. So by law, Medicare Advantage plans must provide all the benefits that original Medicare does. So plans combine Part A and B coverage in one package. One exception is hospice care, which covered by Part A even when you have Medicare Advantage plan. Most Medicare Advantage plan also includes built-in prescription drug coverage, or Part D, which we will talk about next. Finally, Medicare Advantage plans may also offer additional benefits, including coverage for dental, vision, or hearing care, as well as fitness program. The result is an all-in-one plan similar to what you may be used to have when you have it through an employer. There are many different types of Medicare Advantage plans. Most are coordinated care plans, where care is delivered through a provider network. You may get care outside of the network, but you may have to pay more, or even the full cost. Most coordinated care plans are HMO or PPO plan. HMO plans have networks of doctors, hospital, and other care providers to use to receive cover services. POS plan are type of HMO plan that also lets you to go see outside of the network. PPO plans have providers network you can use, but also offer more freedoms to see provider outside of the network for all the cover services. Special needs plans are designed specifically for people with certain healthcare needs. The dual special needs plan we talked about earlier is a kind of special needs plan specifically for those who have both Medicare and Medicaid coverage. There are also chronic special needs plans as well, cater for people that have chronic conditions such as diabetes. Institutions special needs plan is for people living in skilled nurse facility. An institutional equivalent special needs plan is for people living in the community and need the same kind of care as those who live in skilled nursing facility. Private fees for service plan typically offer more flexibility in choosing provider than other types of plans do. In general, you can get care from any Medicare approval providers who accept Medicare. And here are some fast facts for Medicare Advantage. So you must still be enrolled in Part A, Medicare Part A and B, and live in service area. Can be denied coverage based on current financial and health status, including pre-existing conditions. May be required to use provider and pharmacy networks. Coverage and costs vary by plan and may change each year. An annual limit on out-of-pocket costs for Medicare covered services. Current limit is $9,350 and may charge a monthly plan premium. Must continue to pay Part B premiums to Medicare. Now let's move on to Part D, prescription drug coverage. An easy way to remember is Part D. D stands for drug. So there are two ways you can get the prescription drug plan. One is through a separate standalone Part D plan. Two, or through a Medicare Advantage plan we just discussed. Standalone Part D can work with original Medicare, Medicare supplement coverage, and select Medicare Advantage plan, for example, private fee-for-service plan and medical savings accounts plan, MSA, without drug coverage. And like Medicare Advantage plans, Part D plans are offered by private insurance company. Each Part D plan or Medicare Advantage plans that include drug coverage create a list of specific drugs that will be covered. The list is called formulary. Each plan has its own list of covered drugs, but every plan must cover a range of both generic and brand name drugs that are generally needed by people on Medicare. Plans also cover all commercially available vaccines, like the shingle shots that aren't covered by Part B. Part B covers things like flu or ammonia shots. So Part D has different tiers in the formulary, which is a list of prescriptions covered by a plan. So for example, tier 1 and 2 usually is the lower cost medication such as generic, and then as we go higher the tier, it is more expensive such as the brand name drug or specialty medications. So Part D has a range of coverage and it is by stages. So the beginning stage is the annual deductible. So if your plans has an annual deductible, you will have to pay those deductible down first before the plan pay. And then moving on will be the initial coverage. So the initial coverage, as long as you or some other plan, for example, would be the prescription plan, cover the total $2,000, then you will be able to get out of the initial coverage. So that will move you to the catastrophic coverage. Once you hit the catastrophic coverage, you will not need to pay anything out of pocket. So these are the fast facts. Prescription drug, as long as you enrolled in Part A or B or both, you will qualify. So some of the plan you will require to use in-network pharmacy. Coverage and cost vary by plan. It may even change every year. Part D premium penalty for late enrollment unless you qualify for special enrollment period. Now let's talk about Medicare Supplements Insurance, also known as Medicare. Medicare Supplements Insurance, which are also offered by private insurance company, are different from the plans we have discussed so far. As the name says, they supplement Medicare, so they are not Medicare plans and in and for by themselves. Medicare Supplements Insurance plans help to pay some of the out-of-pocket costs that come with Medicare, like deductible and co-insurance. They can only be used with original Medicare, not with Medicare Advantage. Plans are standardized by federal governments. There are 10 plans labeled with letters. For example, Plan A. Every plan of the same letter provides the same benefits no matter what insurance companies offers it. Massachusetts, Minnesota, Wisconsin are exceptions to the rule as these states standardize their plans differently. It's also important to note that Plan C and Plan F are only available to individuals who are eligible to Part A or turn 65 before January 1st, 2020. Here are some of the costs that Medicare supplement plans may help with and some may not. You will see that they help pay with coverage already covered by original Medicare and may extend it in some cases with extra hospital stay. Medicare plans can help with Part A deductibles, original Medicare's copay, co-insurance and provider excessive charges, cost of blood transfusions, and cost of foreign travel emergency. Additionally, some programs may cover Part B deductible costs, but only for those individuals who were eligible for Part A or turn 65 before January 1st, 2020. But except for foreign travel emergency coverage, Medicare plans don't fill in what Medicare doesn't cover, such as prescription drug or dental and vision care. Some plan providers may offer value-added services for free or discount basis, but they are not part of the Medicare plans directly. Here is the chart. You can see the overview of the 10 Medicare plans and what they cover. So we have Plan A, B, D, G, K, L, M, N, C, F. So for example, for Plan L, the plan that it shows the 100% Part A for the hospital stay. So as you can see, some plans, they cover certain items and some plans are not. So it's important to go ahead, take a detailed look at it to see which one is the most optimal for you. So Medicare supplements FastVets must be enrolled in both Medicare Part A and B and live in the states where the plan is offered. No medical underwriting up to 6 months after enroll in Part B at age of 65 or older. Nationwide coverage and no provide network. Guarantee renewable as long as you pay your premium. Plan premiums may vary for same coverage. So what that means, for example, if you have a friend who has Plan F and live in a different state, different area, the premiums you both pay could be different. Plans with more coverage generally have higher premiums. You must continue to pay Part B premiums to Medicare